ताजे परिणाम कितें जाता आनी ताजे सायन्स एंड सिम्पटम्स कितें आनी हाजेर ट्रिटमेंट आसा की ना आनी आसा जाल्यार तो खंय उपलब्ध आसा ह्या तुमच्या प्रश्नांचेर आमी उत्तर दिवपाचे प्रयत्न करतले.
नमस्कार. येवकार प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक माय मोगाचो येवकार. इश्टानो, आमच्या खासगी जिवितांत आमी तरेतरेची व्यसनां पळयता, जशी सिगरेट बिडी ओडप, सोरो पिवप, गुंगी वखदां घेवप. तो आयज आमचो जो विशय आसा तो सबस्टन्स अब्यूज नाल्यार गुंगी वखदाचो वेपार करून एडिक्शन पळय जाता त्या विशयाचेर आसतलो. आनी म्हज्या सांगाताक आसा डॉक्टर राजेश धुमे. तर पळोवया डॉक्टर राजेश धुमेची एक ल्हानशी वळख.
डॉक्टर राजेश धुमे हेणे आपले MBBSचे शिक्षण 1987 गोवा युनिव्हर्सिटींतल्यान पुराय केले. मागीर डॉक्टर ऑफ मेडिसिनाची डिग्री 1997 तेंच्यांनी गोवा युनिव्हर्सिटींतल्यान मेळयली. 2001तल्यान ते सायकियाट्रिस्ट म्हणून कार्यरत आसा. 2003 ते 2005 मेरेन डॉक्टर राजेश गोवा हेल्थ टास्क फोर्साचे मेंबर असले. 2004 ते 2010 मेरेन त्याने द IPS गोवा स्टेट ब्रांचीच्या सुसायड प्रिव्हेन्शन हेल्पलाईन प्रोजेक्टार काम केला. डॉक्टर राजेश हे नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलांत 10 बेडेड डिटॉक्सिफिकेशन युनिट चलयतात. तशेंच डॉक्टर राजेश हेंका पुणे, नागपूर, नाशिक, सुरत हांगासर एकाडेमीक प्रोग्रामांत स्पीकर म्हणून आमंत्रीत केल्ले.
इश्टांनो, आयचो विशय जावन आसा गुंगी वखदाचो वापर आनी ताजे परिणाम. आनी तुमकां खबर आसा आमचो लायव्ह प्रोग्राम आसा, फोन इन जावन आसा. आमचे फोन नंबर जावन आसा 24904444 आनी 24904445. आमचे फोन लायन्स ओपन आसा. तुमचे प्रश्न तयार दवरून आमकां नक्कीच कॉल करात. त्या भायर सोशल मिडियाचेर आमचे लायव्ह यूट्यूब लायव्ह, फेसबूक लायव्ह आसा. त्या चॅट बॉक्सांनी तुमचे मेसेज तुम्ही ड्रॉप करू शकता आनी आमी तुमचे प्रश्न डेफिनेटली आन्सर करतले. सो डॉक्टर राजेश धुमे, तुका येवकार आमच्या आयच्या कार्यावळींत.
नमस्कार.
सर, सबस्टन्स अब्यूज आनी सबस्टन्सीस, वॉट इज द मिनींग ऑफ दीस?
हय, खंयचीय जी गुळी वखदां आसा ताचो परिणाम डायरेक्टली ब्रेनाचेर जाता आनी स्वभावान बदल जाता. अशा सबस्टन्सीक आमी सायकोट्रॉपिक मेडिसिन्स म्हणटात. ते सबस्टन्स कितें आसूंक शकता. अल्कोहोल आसूंक शकता, टोबॅको आसूंक शकता, हेरोइन, मारुवाना, कोकेन असल्योय गजाली आसूंक शकता. तांकां एका कॅटेगरीन घालतात आमी. ताका कॅटेगरीन म्हणटा आमी सबस्टन्स अब्यूज.
सो अल्कोहोल पळय आमी जे सोशल ड्रिंकिंग पळय आसता, दॅट ऑल्सो इज इन्क्लुडेड इन सबस्टन्स अब्यूज. सो वॉट डिफरन्स इन हॅबिच्युअल यूज आनी एडिक्शन, हाजे मदीं कितें अंतर आसता?
हय, WHOन एक व्हडली जागतीक एक अशी रिसर्च केल्लो आनी त्या रिसर्चान तांकां अशें पळोवन आयलें, स्पेसिफिकली आमचो आल्कोहोल जर तर घेतलें, सोऱ्याचें सेवन जर तर घेतलें जाल्यार ते 3 पद्दतीन जाता अशें WHO म्हणटा. एक म्हणटा ते यूज, म्हणजे जे सोऱ्याचो यूज करतात सोशल फंक्शनाक म्हण किंवा कल्चरल फंक्शनाक म्हण. दुसरो, युजा वयल्यान यूज करता करता मनीस एब्यूज करूंक सुरू करता, म्हणजे गरजे परस चड वापरप आनी चड घेवन हें करप जाता. आनी तिसरें म्हणटा ते एडिक्शन किंवा डिपेंडन्स. म्हणजे हो स्पॅक्ट्रम म्हणटा तर पळयलो, यूज, एब्यूज एंड एडिक्शन. ही वाटचाल युजा वयल्यान सुरू जाता, युजाचो मागीर एब्यूज जाता आनी एब्यूजा वयल्यान तो तरणाटो एडिक्शनान पावता. म्हणजे ही वाटचाल आसा ही कोण केन्ना खंयच्या पातळी वयल्यान खंय पावतलो हें सांगूंक अजून पर्यंत तरी कठीण आसा.
So a habit can turn into an addiction very fast based
Absolutely.
on you never know when it will happen.
Yeah. There are some factors.
Yeah, I was going to ask you the same thing. What are the factors that would change a habit into an addiction?
सगळ्यान पयली म्हणपाचो तो ताका त्या मनशाक जर तर एक फॅमिली एडिक्शन आसा म्हणजे ताजें एडिक्शन ताज्या फॅमिलीन चलता जाल्यार एक, ताज्या मित्र मंडळ आनी परिसरान जर तर ह्या गोश्टीचो उजार जाता जाल्यार दोन, तिसरें म्हणल्यार ताका जर तर कितें पियर प्रेशर म्हण किंवा कितें म्हण किंवा ताका जर तर कितें मनाची दुखणी किंवा मेंटल हेल्थ प्रॉब्लेम्स आसा जाल्यार तो केन्ना केन्नाय गुळी वखदाचें सेवन करून आपलोच ट्रिटमेंट करपाक करता. सो अशे खातीर हे फॅक्टर्स जावंक शकता. आनी एक गोष्ट जी तरणाट्यान आमी पळयल्यात, इट कम्स एज अ फॅड ऑर अ फॅशन की इट इज एन इन थिंग to drink at parties. There is no party. It is not a party if it is a dry drink. Party.
Yeah.
Dry रे अशें म्हणटा की तोंड पडटा लोकांचें. So this is what is the cultural expectation. There is always alcohol as some sort of mind altering substances in places where we are into a recreation.
Okay. So when can you get addicted by just taking alcohol or smoking or taking drugs just once?
Very difficult question to answer. If you have a vulnerable personality, this study has been done in heroin, that sometimes only one use of heroin can completely change the brain for life. And the person can be addicted to even one or two instances where the person takes heroin, he can be he can get into addiction. It depends on his vulnerability in his brain.
Right. So sir, who are susceptible to substance abuse? Is there a particular age group ज्या उमक्याच वयाचेर आमी substance abuse addictionank we can get trapped in it?
हय, जे फॉर्मेटिव्ह इयर्स आसता पळय, जशे स्पेशली टीनेज, दिस इज अ एज वेरीन the teenager किंवा जो तरणाटो tries to make a place for himself into this community. त्या वेळार केन्ना केन्नाय they are into a rebellious sort of nature wherein they feel that they are neither young nor they are older, and in this state of flux at times they are carried away by what the peers tell them or what the elder people in the family are observed to doing, and they might also feel that somebody introduces them that हे घेवन पळय, हे घेतकीर तुका बरी शांत दिसतलें, टेन्शन दिसता मरे, हे घेवन पळय शांत दिसतलें, असो एक उपदेश सुद्दां खूब लोक करतात. आनी तातूंत त्या मनशाक जर तर वल्नरेबिलिटी आसा जी प्रॉबेबली जिनेटीक आसूंक शकता, प्रॉबेबली सिट्युएशनल आसूंक शकता किंवा प्रॉबेबली कल्चरली सुद्दां आसूंक शकता, जाल्यार ती तो सेवन करतकीच ताका इतलें बरें दिसता जिवाक की ताका करत रावचें दिसता. बिकॉज हे सबस्टन्स पळय आसा, हे सबस्टन्स एफेक्ट्स आवर प्लेजर सर्किट इन द ब्रेन, एंड प्लेजर सर्किट इज समथिंग that we always try to please. They always try to, we would like that the pleasure circuit in our brain gets lightened up.
Right. तर आमकां एक सोशल मिडियाचेर क्वेश्चन आयला, इज इट पॉसिबल फॉर एन अल्कोहॉल एडिक्ट टू लीव द हॅबिट कम्प्लिटली एंड वॉट इज द प्रोसिजर?
See, first and foremost, it is possible to leave the addiction completely. It all depends on how long he has been using the substance. Number two, what is his family support? Number three, how motivated is he to remain away from the causative agent? And number four, if there is an underlying psychiatric illness, then he will require treatment in that underlying psychiatric illness and area before he gets, because sometimes alcoholism is a symptom of an underlying mental illness.
Right. So the second part of his question, what should be the procedure to get out of alcoholism?
Sure, the first procedure is, the first step is acceptance that you have a problem.
Yes, that is the
Once
first
you
step.
accept that you have a problem,
you will work
then
to
things
solve
will become very easy for you. Accept करतकीच next step म्हणल्यार आमचे ट्रिटमेंट सेंटराचेर खंय तुम्ही वचचें. गोंयान आतां एडिक्शन ट्रिटमेंट फॅसिलिटी ही नवी फॅसिलिटी सुरू केल्ली आसा, आनी इट्स अ फ्लॅगशीप प्रोग्राम ऑफ द ऑल इंडिया इन्स्टिट्यूट ऑफ मेडिकल सायन्सीस, न्यू दिल्ली, and Ministry of Social Justice and Empowerment. So ATF, which is the short form of Addiction Treatment Facility, is available in North Goa District Hospital in Mapsa. on the second floor. So anyone who has a substance related problem, please present yourself to our center. We will take your treatment through. The only thing you have to do is to be ready to help yourself give up the addiction.
Right. Doctor, our second question on social media we have is, how does substance abuse impact a person's life, and if it is hereditary, can you elaborate?
Yeah, I'll take the second question first. How does it affect life? First question is, how does it affect life? See, what happens is, when you have a substance that affects your pleasure circuit, the tendency of the human being is to always be in a pleasurable situation. So the more you get hooked to the pleasure, the more you would like to use the substance to continuously stay in that pleasure thing. हे करता करता नॉर्मल तुमची जी लायफ आसा, फॅमिली लायफ म्हण, कामाची लायफ म्हण, फ्रेंडा वांगडाची लायफ म्हण, घरची बाकीचे परसरांतली लायफ म्हण किंवा बाकीचे सोशल लायफ म्हण, हातूंतल्यान तूं हांकां तूं दुर्लक्ष करीत रावता, कित्याक द टेंडन्सी इज ओनली टू रिमेन हाय. So not only does it affect you, leading to various organ failures, various organ problems, it also leads you to lose a lot of people around you. We sometimes say that one alcoholic in the family destroys 5 lives around it. So it's very important for you to understand that this is the part of life that gets destroyed. And the younger you start using substances, the more difficult it becomes for you to give up. The second part was that of genetics. It's a difficult situation to understand whether it's exactly the genetics or is it the observation that you get because you have an alcoholic father. But अशें पळोवंक आयला रिसर्चाच्यान की the father probably begets a son who has got the same psychological vulnerability, and therefore because he inherits a particular genetic profile, at least the 23 chromosomes, at least the half of the, if the mother also has someone who is an alcoholic in the family, she also will bring some loading. If that loading comes to a precarious nature, it is quite possible that in a vulnerable person, in a vulnerable situation, in a stressful life event, person might resort to alcoholism, fall in love with the substance because of the pleasure, and then end up being an alcoholic. Also, because he has an alcoholic father or a parent, he has observed drinking behavior in the house.
Yes. All right. Doctor, we have another question here. We see the alcohol problem in a state like Punjab. How does the culture play a role? And how can you interpret Goa per se, where alcohol is cheaper than fuel?
Yeah, we understand about Punjab. Punjab has several issues that are there. Probably it's beyond the scope of this program to discuss the socio-cultural effects of
on substance abuse.
As far as Goa is concerned, we had the 450 years Portuguese rule, which brought in a lot of European type of behaviors. Some of them included the behavior of social drinking. I do not say that drinking was not there 450 years back. It may have been there. However, that so-called Portuguese culture, European culture, gave us a very unique identity, which gave us the so-called touristy of free nature label. And today, with the economic on tourists, one of the things that people do coming here is probably drink and have fun, and the context of fun is drinking and partying and dancing and using
often
substances.
that is how Goa is portrayed in our Bollywood
That is how
movies.
Goa is portrayed, but Goa is much more beautiful than what it is to be known only for alcohol and substances.
Yes, right. So doctor, how do we know if someone is addicted to a substance? Are there any signs and symptoms? Besides, of course, if an alcoholic, you will definitely know if he comes home drunk. But
Yeah.
besides that,
If the common things are that you know is about alcohol, it's prevalent everywhere, and if it's prevalent everywhere, then you probably have, you know, the symptoms of drunkenness, slurred speech, red eyes, you know, a waddling gait, and abusive language, all that. So you do not know what. Tobacco also creates some sort of problems of headaches if you do not smoke or you do not chew tobacco, problems with digestion and all other things which reflect in the behavior. Coming to other substances like marijuana or heroin or cocaine, they have severe psychological and physical withdrawal symptoms, which may border on to simple sweating, irritability, loss of appetite, lack of sleep, to florid symptoms of mental illness like hearing voices, seeing visions, and becoming completely psychiatrically unwell, leading to loss of touch with reality, and you get into this so-called psychotic behavior. So these are some things that we have to be watchful about. Also, if you have somebody who uses now marijuana, calling it quote unquote recreational use, you have the red eyes that you probably see, a dulled appearance, unnecessarily calm persona. This is one of the common things. Not that this is the one that presents, but there may be many others that are presented depending on the substance.
ओके. तर तुझे स्टॅटिस्टिक्सा प्रमाणे गोंयांत मेल्स आणि फिमेल्स the rate of substance abuse is the same, or is it more dominant in the male category?
It is more dominantly seen in the males as compared to, but young children and females are fast catching up. Yes. The national survey showed that there is an increase of, there is a decrease of age of drinking. There was a family survey done, probably I stand corrected, in 2001.
Doctor, just a moment. We
Yes.
got a call, so we'll take this call. Hello? 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 Hello?
हॅलो
हॅलो?
हॅलो
या ओय विचारा, प्रश्न विचारा तुमचो.
हॅलो ऐकू आहे ना?
वय वय येता, आयकोंक येता. सांग. तुमचं टीव्हीचा व्हॉल्यूम मातसो स्लो दवर.
बरें बरें.
होय, आता तुमचं क्वेश्चन विचारा.
हांव एक दोतोराक विचारता. डॉक्टर, तुमचो एक प्रश्न आसा असो. आतां भुरगीं घरांतूच वाडटा आवय बापूय सोरो घेता, चितकोता आनी आपल्या फुड्यान बसून ताका इलो इलो दिता. मागीर ती व्हड व्हड जाता, तेच बराबर मागीर ती पिवं लागतात आनी कोण्या चोयलें सारक्या चोयलें बरें दिसना आनी तें सांगिल्लें जाय तूं वडिलांक ती म्हळ्यार तूं कित्याक पडा, तुगे तूं पडे. आनी हे भुरग्यांक हें जायते पाटी येता, दिसताय खंय खंय गँगां, आनी ती व्हड जाली आनी ती गँगां आतां आनी रातची बोन हे ते नाच दास, मागीर ते गोंगी वखदां हें तें, मागीर खंयची राती घरान भितर सरप. तरी हें घरा म्हाजी मनीस तांकां विचारना आनी विचारल्यार तांकां कोंता येना. म्हणटरी हें आतां आमगे थोडे जावपा ल्हानूच भुरग्यांक शिकोवपाक आमी कितें करपा जाय दोतोर?
ओके.
पयले स्वातीर भुरग्यांक कसलीच वया प्रमाणे हॅबीट लावन दिवप ना, किंवा टेस्ट करून दिवप ना. केन्ना केन्ना कितें आसता, टेस्ट करतकीच ताका एक प्रायमींग इफेक्ट म्हणून येता, आनी तो प्रायमींग इफेक्ट येता म्हणून ताजेर वयाच्या पयलीं ब्रेनाचेर परिणाम जावंक शकता. हो कंप्लिटली अवॉयड करपाक जाय. आनी हे अशें आयकूंक आयलां आमी की पेरंट्स वांगडा भुरग्यांक बसोवन तांकां, पेरंट्स आनी ताजे फ्रेंड्स बसल्या आनी हांगा कोण तरी धाकटो भुरगो आयलो, ताका इल्लीशी बियर पिवयली, कांय जायना अशें म्हणून. पूण एग्जॅक्ट आमी स्टडी असो करूंक ना, पण आमकां दिसून आयलो की अशा भुरग्यांचे फुडार जो आसा तो केन्ना केन्ना अल्कोहोलीक जावंक शकता. आनी ते कारणा शिवाय रिस्क घेवपाक सोदतात. सो ही जी भुरगीं अशे आमली पदार्थान बेगीन प्रवेश करतात, तांचे बिहेवियर फुडें वतकीच एंटी सोशल किंवा डिसोशल अशें जावंक शकता. आनी त्या खातीर तुमी म्हणटा तशें तो गँगान मिक्स जाता किंवा कितें की ताका रिस्क घेवन दिसता आनी ते सबस्टन्स ताका रिस्क घेवपाची परवानगी दिता, कित्याक ते तकलेचेर एफेक्ट करून ताजो जजमेंट हालयता.
सो बेजिकली आवय बापायची जबाबदारी आसता की भुरग्यांक पयलीं ल्हान वयासान सोरो पिवपाक दिवप ना पाटयांक अशें तूं म्हणूं सोदता डॉक्टर. आनी आय थिंक म्हाका दिसता सेम विथ स्मोकींग ऑल्सो, कित्याक जेन्ना बापूय सिगार ओडटा तर पॅसिव स्मोकींग जे आसता त्या वासानूच एडिक्शन सुद्दां सुरू जावंक शकता. तुजें मत कितें दोतोर?
बरोबर. सो पॅसिव स्मोकींग दे से इज इवन वर्स दॅन एक्टिव स्मोकींग, because it not only affects anybody around, it affects several people around, and including that child may feel की ताका दिसता की आपूण होय करता जाल्यार हातून वायट कितें आसा. ताका ती एक व्हॅल्यू सिस्टम येना. अशें ना, व्हॅल्यू सिस्टम घरचे शिकयता, घरचे भायले लोक सुद्दां शिकयतात. टिचराक पळयलो सिगार ओडटा आसतना जाल्यार तोच प्रभाव जावंक शकता. फ्रेंडाच्या बापायक पळयलो जाका तो मानता जाल्यार तोच प्रभाव जावंक शकता. एका एक्टराक पळयलो जो सिगरेट ओडटा जाल्यार ताचेर प्रभाव जावंक शकता. त्या खातीर आमी सिनेमान नाटकांनी सिगार ओडपाचें जें आसा ताचेर आमी डिस्क्लेमर घालतात की अशें करूंक जायना, हे इंजरीज टू हेल्थ म्हणून. पूण तो प्रायमींग इफेक्ट जो जाता तो जावंक शकता.
रायट. सो कॉल येवच्या पयलीं दोतोर आमी उलयतालीं आमकां कशें कळटलें की एखादो मनीस गुंगी वखदां घेता किंवा एडिक्शनान आसा म्हूण? सो तेजेर तूं आनीक भासाभास करूंक शकता?
हय, सबस्टन्सा प्रमाणे ताजे सिम्पटम आनी सायन पळय आसा ते वेगवेगळे आसता. जशें हांवें सांगलें की आल्कोलाचेर तुका सांगचे गरज ना की तो पिला म्हणून. सिगारान ओडला म्हणून सांगची गरज ना, तो वासूच तुमकां सांगता की ओडला काय न ओडला तें. पण ही बाकीची जी आसा सबस्टन्सीस, बाकीचे सबस्टन्सीस जे आसा
ते कळचे ना तुका,
ते कळना. त्या खातीर ताजेर स्वभावाचेर लक्ष दिवचो पडटा की ताजो बिहेवियर कसो चेंज जाता. जो मनीस शांत आशिल्लो तो अशांत जावंक शकता. जो अशांत आशिल्लो मनीस सडनली थंड जावन बसूंक शकता. घरा भायर न सरपाची तांची प्रक्रिया वाडटा. मागीर एकटोच लॉक करून बसपाची प्रक्रिया वाडटा. कित्याक जनरली स्पिकींग हे सगळें लिपून केलें जाता, कित्याक ह्यो सगळ्यो सबस्टन्सीस इल्लिगल, कायद्यान बसना. NDPS एक्टाच्या अंडर ह्यो सगळ्यो सबस्टन्सीस येता. त्या खातीर ह्या गोश्टीचें सेवन आनी ते वांगडा आपल्या वांगडा आंगार दवरप ही एक क्रायम जावन आसा. सो हे कितें करतात, ती पिकअप करतकीच खंय तरी लिपून ह्यो गजाली करपाच्यो अशे निर्णय घेतात. घरा कडेन केन्नाच चड करून करिनात. सामकेच एडिक्ट जाले, सामके स्वताचे गेले जाल्यार मागीर ते घरा कडेन सुद्दां सुरू जावं येता. मागीर तो बिहेवियर तुमकां दिसून येता.
म्हाका दिसता घरच्यांचें ऑब्जर्वेशन खूबच महत्वाचें आसा अशें दिसता, कित्याक इवन द नीड फॉर मनी, बिकॉज ऑब्वियसली ऑल दीज ड्रग्स एंड अल्कोहॉल एंड सिगरेट्स विल कॉस्ट मनी. सो द नीड फॉर मनी, देन स्टीलिंग, ऑल दीज ऑल्सो फॅक्टर्स विल help you to doubt and guess if a person is addicted.
बरोबर. चोरयो घरान करप किंवा जाणट्यांचेर अटॅक करप, पयशे काडपाक, कोणाक इंटिमिडेट करप, कोणाक धमकोवप, अशा ह्यो गजाली खुबश्यो जाता. आनी खुबशे लोक आमचे जे पेशंट आमचे आसा ते कायद्याचे विरुद्ध खंय ना खंय तरी गेल्ले आसता.
Doctor, does addiction eventually lead to mental disorders?
Yeah, addiction may lead to mental disorders, but more so it leads to mental disorders brought about by the substance.
Okay.
So we have several mental disorders that are associated with it. So sometimes mental disorders make a person vulnerable to use substances, and the use of substance and the abuse and addiction to the substance presents its own set of withdrawal symptoms which border on to mental illness. So this is what we have to understand, that mental illness can be caused by substances and can be the effect of substances. सो बोथ वेज.
रायट. तर एडिक्शन आणि डिपेंडन्स हाजे मदीं कितें डिफरन्स अशें आसा मेडिकली यू थिंक?
No, I think we use this substance, we use this word interactively and interchangeably.
Okay.
So, substance abuse might not be understood to the general public. So, we want to make a very clear statement that habit and addiction is completely different.
Different, yes.
Habit doesn't make a person
Addicted.
doesn't make a person destroy his life.
Right.
It may border on to habit, just serious samko habit zalo ala, he is going into addiction. So that is called as harmful use.
Okay.
So you have use, abuse or harmful use, and you have addiction, which is a disorder, which is a mental illness. So if it crosses the middle path, then it becomes a mental illness. Because then it is you are doing things which is detrimental to you or detrimental to others. So your behavior becomes detrimental to you or detrimental to others.
Right. Doctor, what is the treatment for any kind of addiction? Is it treatable or is like the end of the road for that person?
Not really the end of the road. The first step of treatment, as I said, was acceptance that you have a problem. चड करून लोक जे खूब पितात ते सुद्दां तांकां दिसता की आपल्याक काय प्रॉब्लेम ना, आपण केन्नाय सोडूंक सोदता. चवथीच्या पयलीं श्रावणान आपूण 40 दीस बंद करता, आनी केन्ना लेंतान आपूण बंद करता, आनी रमजानान आपूण बंद करता अशें म्हणटात. ते मागीर जशें जशें तांच्यो संवयो वाडत चलता ते तितले सुद्दां एब्स्टिनन्स करपाक तांच्यांनी जायना, तांकां विड्रॉवल सिम्पटम्स येतात. So progressively, when you are seeing, it is a progressive deteriorating type of course, and therefore you have to accept that it is not my habit but my mental illness that is catching up with me. I am getting dependent, and dependence is a mental illness. So if I say that म्हाका सकाळी घेवचेच पडटा, नाजाल्यार म्हजे हात कडकडटा आनी हांव बारीक काम करपी कारीगर, जाल्यार I am now to continue my profession I have to drink. So I am trying to justify to myself saying that म्हाका पिवचेच पडटले, नाजाल्यार हात कडकडटले, हात कडकडल्यार म्हज्यान काम जावचें ना. So this is how the addict tries to justify a lot of his behavior. Common justifications are हांव हार्ड काम करता, म्हाका पिवचें पडटा,
म्हाका न्हीद पडना,
न्हीद पडना, किंवा मागीर अशें म्हणटा की हांव कचरो काडटा, हांव घाण येता थंय काम करता म्हणून म्हाका पिवचें पडटा. ह्यो ज्यो कारणां सांगतात पळय न्ही, ते मनशान केन्नाच एक्सेप्ट करना. तांचें मोटिवेशन लेवल टू स्टॉप इज व्हेरी लेस, बिकॉज दे कीप ऑन टेलिंग देमसेल्फ दॅट इट नीड्स, द पर्सन नीड्स दॅट सबस्टन्स.
यू कीप टेलिंग इट टू योरसेल्फ.
या.
तर एक क्वेश्चन आयला आमकां फेसबुकाचेर, सायड इफेक्ट्स ऑफ लिवर सिरोसिस, वॉट आर द सायड इफेक्ट्स ऑफ दिस ऑन अ पर्सन्स मेंटल हेल्थ?
Side effect of cirrhosis on person's mental health, what is directly going to happen is that liver is going to fail. Cirrhosis is nothing but liver failure, and then the blood gets detoxified in the liver, and when the liver becomes very rough, which is called as cirrhosis, as the blood courses through the liver, it breaks down, leading to jaundice, and when the jaundice level rises, it ends up giving you mental health problems, because it is a toxic chemical that is now seen to be going around in your bloodstream. So yes, liver cirrhosis will definitely lead to that, but as the person has got liver cirrhosis, it is but obvious that he will have other organ failures. He will also have a deterioration in his brain. Brain will also start shrinking. We call that as alcohol-induced atrophy of the brain. It starts shrinking. The heart starts becoming flabby. The spleen, which is also an important organ, starts to expand. The kidneys start to become defective. The locomotor system starts to become affected. The nervous system starts to become affected, and the nerves there start to die out, which we call as peripheral neuritis. So typically एक पिणारो मनीस जर तर खूब पियेता तो सांगतलो हात पाय आपलो मुयेता, केन्ना केन्ना गरम जाता, केन्ना केन्ना पांयांतले चप्पल सुट्टा, ताका खिणां पडटात की ताका उठूंक येना, ताजे पांयाचे सगळे दोखल्यो जातात, बिकॉज दी appetite is gone when the liver is affected, and when the appetite is gone the intake suffers. When the intake suffers, he goes into alcohol induced cachexia or alcohol induced weakness. So alcohol is a total body destructive sort of chemical which we drink saying that it's like the way of life, but in people who are vulnerable it's an extremely dangerous chemical.
सो बेसिकली सिरोसिस ऑफ लिव्हर नॉट ओनली अफेक्ट्स युअर माइंड बट तुझी अख्खी बॉडी मार खाता.
हय, एकूच लिव्हर आसा न्ही,
हय सगळे
एकूच लिव्हर आसा. सो इट इज दी पावर हाऊस न्ही. हय, इट्स दी पावर हाऊस ऑफ ऑल डी एडिक्शन, डिटॉक्सिफिकेशन, नॉट डी एडिक्शन, डिटॉक्सिफिकेशन.
तर आमी केन्ना अशें पळयता की एक ड्रग अब्यूज करता तो मनीस, तेका खुबदां इम्प्रूव जावपाक रिहॅबिलिटेशन रिहॅब सेंटरान धाडटा. सो वॉट एक्झॅक्टली इज रिहॅबिलिटेशन?
See, rehabilitation for people who have been using substances is because it has to be done at a various levels. First, we have go through a process of detoxification. म्हणजे त्या आंगान भरिल्ले टॉक्सिन्स आमी पयलीं निवळ करता. ते टॉक्सिन्स निवळ करतकीर then comes a phase of recovery. When you say the phase of recovery, there is a phase of mental recovery, there is a phase of physical recovery, and then there is a phase of social recovery that needs to be done. That part of social recovery is often called as rehabilitation, wherein by the time he has come to that level that it requires rehabilitation, he has destroyed a lot of relationships around him. He might have had a bad marriage, his wife must have left him and gone, his children are negative towards him, the employers don't really want him around, nobody generally wants him around, people avoid him. So if he wants to give up, he has to be reintegrated back into the society. So आमच्या समाजान ताका परतून एक वाटचाल लागून खंय तरी ताका येणावळची साधन दिवन ताका जॉबान रिहॅबिलिटेट करचो पडटा, ताज्या फॅमिलीन ताका रिइंट्रोड्यूस करून करचें पडटा, ताज्या भुरग्यांक कावन्सिलींग दिवचें पडटा, ताज्या बायलेक कावन्सिलींग दिवचें पडटा, ताज्या एम्प्लॉयरांक समोवचें पडटा की बाबा हो पयलींचो असो उरलो ना, आतां हाणें आपल्याचेर ट्रिटमेंट करून उपचार करून हो आतां सोरो पियेना, ताणें बंद केलो. पूण गेल्लो विश्वास पळय आसा तो परतो मेळोवपाक समाजान जी प्रक्रिया आमी यूज करतात ताकाच कदाचित आमी रिहॅबिलिटेशनाचें नांव दितात.
Okay, but rehabilitation includes his overall treatment, including medical treatment as well as psychological help.
It's treatment and rehabilitation. Without rehabilitation, the treatment is never complete.
Right. तर तुम्ही कार्यावळीन पयलीं सांगिल्ले भशेन एडिक्शन ट्रीटमेंट फॅसिलिटी जे गोंयान आहा ताच्या वयर कितें आमकां सांगशी?
हय, एडिक्शन ट्रीटमेंट फॅसिलिटी हाजे पयलीं डिस्ट्रिक्ट हॉस्पिटलान आमी ड्रग ट्रीटमेंट क्लिनीक म्हूण रन करताले. थंय आमचे कडेन लिमिटेड सबस्टन्सांचेर मेडिसिन्स मेळटाले, जशे सोऱ्याचेर मेळटाले, हेरोइनाचेर मेळटाले. पूण आतां एडिक्शन ट्रीटमेंट फॅसिलिटीन खुबशे बाकीच्या सबस्टन्साचे सुद्दां मेडिसीन आमकां फ्री ऑफ कॉस्ट मेळूंक शकता. तुमचे कडेन जर तर गोंयचें वोटींग कार्ड आसा आनी तुमी जर तर गोंयचे वोटर आसा नॉर्थ गोवाक लागून, जाल्यार बेधडक तुमकां जर तर सबस्टन्स एब्यूजचे प्रॉब्लेम आसा जाल्यार तुमी आमचे कडेन येवचें. सेकंड फ्लोरार वचून आमी तुजी वैद्यकीय तपासणी करून शारिरीक दृश्ट्या तपासणी करता, मानसीक दृश्ट्या तपासणी करता, आनी मागीर तुमकां गरज पडल्यार आमचे 10 खाटीचे वॉर्ड आसा जाका आमी एडमिशन करता थंय. कित्याक खुबश्या जाणांक एडमिशनची गरज आसता, तांचे शारिरीक जे स्वास्थ्य आसा तें बिगडलेलें आसता आनी शारिरान खंयचे अवयव ताजे फेल जाल्या हें कळपाक जाय म्हूण ताका आमी इन पेशंट केअर म्हूण आसा. सो आमची एडिक्शन फॅसिलिटी जी आसा, एडिक्शन ट्रिटमेंट फॅसिलिटी, तातूंत OPD म्हणजे आउट पेशंट डिपार्टमेंट आसा आनी इन पेशंट डिपार्टमेंट सुद्दां आसा. आमी हेरोइनाचेर सुद्दां ट्रिटमेंट करतात, आमी मारुवानाचेर किंवा विडाचेर सुद्दां ट्रिटमेंट करतात, आमी अल्कोहोलाचेर करतात, आमी तंबाखूचेर करतात, आमी कोकेनाचेर करतात, आमी चडशे मेडिसिनाचेर करतात, चडशे सबस्टन्साचेर ट्रिटमेंट करता. आनी तुमी येतकीच मागीर तुमी डिटेल्स आमकां दितकीच तुमच्या वांगडा एकटो कोणी मनीस येवचो पडटा जो तुमच्या खातीर एक कन्सेंट फॉर्म तुमच्या पेशंटा बरोबर सायन करता. कित्याक केन्ना केन्ना कितें आसा, आमचो जो पेशंट येता ताची मानसीक परिस्थिती सारकी नासता आनी मानसीक परिस्थिती सारकी नासता म्हणटकीच कोणे तरी एक दुसऱ्या मनशान ताजे खातीर सायन करची पडटा, कदाचित तो बापूय आसूंक शकता, आवय आसूंक शकता, बायल, भाव, भयण कोणूय आसूंक शकता. एकदा ते केलें की आमी डिसायड करता की ताका ओपीडीचेरूच ट्रिटमेंट करचो काय ताका एडमीट करून करचो पडटा. सो हे दोन्ही फॅसिलिटी असल्या कारणान आमचो सगळो ATF हो कंपोजीट ट्रिटमेंट प्रोग्राम जावन आसा आनी हाजो पुराय खर्च गव्हर्मेंट ऑफ इंडिया करता. वखदांचो म्हण, दोतोरांचो म्हण सगळो खर्च जो आसा तो करता आनी गोंयची सरकार ताका जेवणा खाणाची वेवस्था, रावपा करपाची वेवस्था हे गोंयचे सरकार आमच्या नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलान तांकां फ्री ऑफ कॉस्ट पाळून दिता.
रायट. दोतोर, एक क्वेश्चन आयला आमकां, वॉट इज द अप्रॉक्सिमेट डेटा ऑफ एडिक्शन इन गोवा? सो आय थिंक दे वॉन्ट टू नो द डेटा ऑफ वेरियस एडिक्शन्स इन गोवा. What is the
I
statistics?
cannot tell you offhand because there are several studies that have given us a different thing, but over an average we can say in an anecdotal fashion that various substances, like for example we have no data about a heroin addiction, we have no data about marijuana addiction because those people do not come to us for treatment. This is the hidden population. We know that things are being used, they are being abused, but only when people reach to a particular level we have. If you say in my heroin treatment clinic, we have over the period of 4-5 years now, we have treated almost around, I would say, 2,500 users. We have 2,500 users. Some of them are repeat users. So on an average, we see around 3 or 4 new patients of heroin addiction in a month. And those people keep on coming because we use something called as the substitution treatment. On an average, if you look at all dependence illnesses, then we have a population around 15% of our population, 15 to 20% of our population invariably suffers from addictive disorders. This is like something. Sometimes in places like Goa, you may have even 25% for alcohol, and around 25% population use alcohol or abuse alcohol. I'm not saying that they are addicted to alcohol, but definitely 10% of the population have got serious substance related problems, especially alcohol and tobacco.
Right. Doctor, what is the most commonest drugs that have been abused in Goa? Do you see a very common pattern?
Yeah, the commonest drug, we have two types of general things. We have so-called the legal drugs, which is alcohol and tobacco,
Right.
Which gives the government its taxes, and we have got the illicit drugs, which is the marijuana, heroin, cocaine, which is under NDPSA and therefore they are illegal.
Illegal.
So the question was that, can you just tell me the question again,
Yeah,
Stacey?
the question was, which is the most common
Yeah,
drugs that you see in your practice?
Right,
Drug
so the
abuse.
most common thing is alcohol use. We have the alcohol use that tops up everything, and then we have tobacco on the decline to some extent.
Right.
There are several youngsters who are really anti-tobacco rather than the middle age, which was tobacco users. It is
I think
declining.
which is a good thing.
It's pretty good because the government-run tobacco control program is doing a marvelous job, and
Yes.
the
The
NGOs
awareness
working in
is a
this
lot.
field are also doing a marvelous job. It has percolated even to the schools through value education of the education department,
Right.
and that's exactly how we should move forward. That we should give information to the children right from the beginning that these are the issues, so that they can actually
Stay away.
stay away from the detrimental use. So that's the right way forward. Early intervention.
ओके. तर आता तुम्ही म्हणले रिहॅबिलिटेशन सर्विसेस जे आसा, वन्स अ पर्सन इज रिहॅबिलिटेटेड आणि तो आपल्याचे नॉर्मल लायफ जियेता, आर दे चान्सीस की तो परत सबस्टन्स अब्यूज, परत गुंगी वखदां घेवन परत आशिल्ले तशें जिवीत जिवपाक वचूं शकता?
Hi. Alcohol and substance use disorder is a very chronic, relapsing and remitting illness. म्हणजे ते परते जावंक शकता. And तशें पळोवंक गेलें जाल्यार इट इज अ लायफस्टायल इलनेस. जशें आमचें डायबिटीज आसा किंवा प्रेशराचे प्रॉब्लेम आसा, तर डायबेटीक मनशाक सुद्दां शुगर वयर सकयल जावंक शकता. एकाच पातळीचेर तो चलना.
उरना.
ताका केन्नाय स्ट्रेस आयलो जाल्यार ताच्या कारणा शिवाय शुगर वाडटा. ताका कितें केस आयली जाल्यार कारणा शिवाय शुगर वाडटा, किंवा तो तर उपास धरलो जाल्यार शुगर देंवता. ह्यो ह्यो घडावळी ज्यो जाता बॉडीन तशेंच पिवपाची रूच आनी यूज करपाची रूच हाजेरूय स्ट्रेसाक आनी हाजेर कनेक्शन आसा. सो अशें म्हणूंक शकता की जशें तुज्या लायफान वयर सकयल जाता तशेंच केन्ना केन्नाय सबस्टन्स युजान सुद्दां रिलॅप्सीस आनी रेमिशन्स आसता.
रायट. तर एक क्वेश्चन आयला आमकां. इट सेज डज eating disorders also included in substance abuse?
No, they are not. Eating disorders are a separate entity, and they are not included in substance use. These are substances are that things that you consume. It's nothing to do with eating disorders.
Okay, so not even there are some people who just eat because they feel good. So that is also
That's a different sort of
topic entirely.
Yes.
Right. So we were talking about relapse. So are there any triggers to relapse? Something that can trigger a person to go back to his addiction?
Yes, if there are several triggers, and for that we have to be socially aware that a person is a recovering addict. Several times we have and very bad, we in the sense society, we don't accept somebody who is recovered. We try and tell him ki तुवें अशें केल्लें तुका याद आसा. So he says that hi, there are taunting things. No, I don't really trust you because I know your history, you know. These are common things that we see which invariably hurts the sensitive patient. Many patients who are vulnerable are also sensitive.
And their condition is already delicate.
Their condition is precarious, I would say, not even delicate. That they are waiting for a reason to go back into the substance, and they are working hard to stay away from it. So, we have to be supportive and we have to understand. Many a times, घरची बायल किंवा आवय किंवा कितें when you recover and come back, they look at you with a very different very different angle. They look at you with our recovering addicts tell us that, you know, I feel that I'm always on the radar. Somebody will come, just pass by and smell you. And then if you feel tired and if you are slurring, they will say that घेऊन आयला काय कितें तुझे कांयच सांगू जायना. So that high expressed emotions, and therefore during the course of rehabilitation we always educate the family. We also have sessions with the family how to identify early triggers, how they should not be part of a triggering system, and how we give the addict the space that he requires to rejuvenate his life. It's not an easy thing. It's a very, very challenging type of treatment process for the person and for the family.
Right. Dr. Ani, question hai, how do we support someone who is addicted in the family?
First and foremost, you have to understand that addiction is a mental illness. It is not a bad habit. And the person who is drinking or who is smoking is not a bad person.
The minute we label somebody,
we attonate this, we label that person as to white goshti karta, white samay asa, he has got vices. We today know that these so-called vices are nothing but mental illnesses, and therefore if you do not you should understand that he has a problem with alcohol. 100 पिणाऱ्यांतले एक 10% एडिक्ट जातात न्ही, उरिल्ले 90 तर पीत आसता पार्टेक म्हण किंवा कितें, तांकां फरक पडना. म्हजो जो पिणारो पेशंट आसा ताका आज पिल्यार सांजे परतून पिवचें पडटा. तो इतलो आपल्या सायकलीन वता की बियॉन्ड, which is beyond his control. He is not doing it because he wants to do it sometimes. He is doing it because he has to do it to keep away his bad feelings or withdrawal symptoms. So the family has to be supportive enough and give him that space to understand that, and you also understand that like diabetes, this is also, there's going to be relapses. पहिले आम्ही इतले त्रास घेतले, तुका ऍडमिट केलो, परतून तू पियेलो. So these are some of the expressions that I mean, would you say this to a diabetic? Would you say this to a diabetic, saying that कितें आता इतला घरा कडेन पत करता आनी तुका साखरी शिवाय सगळें करून दिता, भायर वता तूं आनी जिलबी खाता, कसलो मनीस जातलो तूं? Are you, I mean, do you have that attitude towards a diabetic? I mean,
so
you wouldn't, right? So if you just put it together some sort of that way, it is considered to be so-called social evil. No, it's not a social evil. It's been there for years together. But it is a problem for that person. The person has got a mental illness here. So we have to be very, very concerned about that. Therefore, you cannot only treat a person. An alcoholic has to be treated along with his family, because they have also gone through a lot of trouble.
And then there will be issues in the family which may be triggering the substance
Absolutely.
abuse also.
There are so many issues, psychological issues in the family that triggers.
Yeah, so if that persists, then the addiction also will keep persisting.
Correct.
Right. Doctor, addiction is treatable, you said. Besides this, besides rehabilitation and psychological, are there any other therapies that can help a person who is addicted with various kind of addictions to improve his condition?
Yeah, so the upcoming therapy is called as motivation enhancing therapy, or MET.
Right.
The motivation enhancing therapy is used to bring our patient to a level in which his motivation to stop increases. Many of the substances take away your motivation to stop. They keep on telling you stories. The brain plays games on you, saying that you need this, you cannot do without it, There is a word in Konkani called as zapatla. You can probably associate it with the substances. The substances तुझे तकलेचे आणि मेंदवाचे काबू घेता आणि तुका तातून आदी करून उडयता, which means that some of them, most of the time, it is beyond that person, which the people cannot understand. So therefore it's a relapsing illness, and a relapsing illness असतकीच तुका तशे प्रॉब्लेम जावंक शकता, परते 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 ते उचकप. So that is where we are. I mean, we have to be very clear, crystal, and give that person the motivational enhancement, and therefore there's a therapy for it.
Right.
थोड्यांक नासता त्यांनी. Plus, if he has got a psychiatric illness, then we have other therapies that help him to get better psychiatrically.
Right. Doctor, any question amka आयला, can we limit ourselves to social drinking, or will it someday end up being an addiction?
It depends on
you.
What is your willpower. There are some people are very disciplined. They will take their 2 pegs on a Saturday and that's it. But there will be some ones who don't know when that 2 will become 3.
And who won't get up till the bottle gets over.
Yeah, and there are some things, our wet parties, that तकलेन level जावपाक जाय म्हणटा. नाजाल्यार पिल्ले भशेन दिसना. See, social drinking doesn't come up to some level in the brain. So it is not drinking to get a hit from alcohol. Whereas many of us in India, we drink to get high. We do not drink to get socially. So when you do that association of getting high, you are putting your body into a harmful use pattern.
Right. So there are question and म्हाका दिसता definitely your question एका गोंयकारानूच विचारला म्हूण, is urrak a natural drink or an alcohol which one should stay away from?
Urrak is an alcohol. First distillate of kaju feni is called urrak. The second distillate urrak galun ani rose galun chizaylo ki feni ata. So urrak will have, I think, around 20 to 30 gram of alcohol, which is like a very strong liqueur. It comes to that level. Natural म्हणजे कितें, most of the things are natural only, no? Grape wine coming from grapes, natural.
Yeah.
Our coconut feni coming from toddy, natural. Kajuntan he jata. Anything that has got sweetness in it can be fermented and can be distilled. So wine can be made from rice also, from wheat, from barley, from anything that has got carbohydrates. Can be converted into all of that is natural.
Right. So Dotor, as we come towards an end of our program, what would be your take-home message for today's episode for all our viewers?
The take-home message is very simple. Addiction is a mental illness. Accept it. If you have a problem with substances, accept that you have a problem and come forward for treatment. Treatment is available at your doorsteps in North Goa District Hospital, at Institute of Psychiatry and Human Behavior, and at South Goa District Hospital. So wherever you are, it's available, made available free of cost to the citizens of this state. We are an extremely progressive state. We are free. We are all together in this, and therefore we should try and support each other to come forward to treatment of substance use disorders. And earlier it was not available. Now we have got a very composite, all-inclusive type of treatment centers in your districts. So addiction treatment facility has been provided in your district, and therefore it has become that much easy for you to seek treatment. So accept that it is an illness and get treatment like any other illness.
And also family needs to support. I think that is also an important part of the message.
Yes.
That your family also should be with you in this journey.
Yes, the better the family support, better is the outcome.
राईट. तर तुम्ही तुझो मोलादीक टायम काडून आमच्या वांगडा स्टुडियोंत आयलो आनी तुम्ही इतले प्रश्नाच्यो जापो दिवन बेसायज इतली म्हायती आमकां दिली व्यसना बद्दल, ताका लागून हांव चड आनी चड तुका देव बरें म्हणटा, देव बरें करूं म्हणटा. प्रुडंटाच्या वतीन आनी म्हज्या हॅलो दोतोर टिमाच्या वतीन थँक्यू. फुडल्या सप्तकाक म्हज्या वांगडा आसतली डॉक्टर पिंकी पालेकर. शी इज अ पिडियाट्रिशियन. सो भुरग्याच्या दुयेंसा विशीं तुमचे कितें प्रश्न आसा ते तुमी तयार दवरात. तो मेरेन पळयत रावात प्रुडंट. काळजी घेयात आनी मोग आसूं.
नमस्कार.
नमस्कार.